Are the pain pills you take every single day quietly destroying your kidneys faster than a glass of alcohol ever could? What your doctor hasn't had time to tell you could be putting your kidney health and your life at serious risk right now. Let me ask you something directly. How many times have you reached for a painkiller this week? Once, 3 times, every single day. Now let me ask you something your doctor may not have brought up at your last appointment. Do you know what that pill is doing to your kidneys every single time you swallow it? I'm Dr. Donald Brown, a nephrologist, a kidney specialist, and I've spent over 2 decades watching something deeply troubling happen inside my clinic over and over again. Patients who ate well, who exercised, who did everything they were told, arriving at my office with kidneys that were quietly failing. And when we traced it back, the answer wasn't alcohol. It wasn't smoking. It was sitting in their medicine cabinet. Today, I need to give you the information your 15-minute appointment simply doesn't allow time for. I'm going to name the specific pain pill that research now shows can cause more cumulative kidney damage than moderate alcohol use. And I'm going to tell you exactly why it happens, who is most at risk, and the 3 practical steps you can take before your very next dose. But here's what I need you to understand before I give you the name. If I just told you what the pill was without explaining the mechanism, that information would be almost useless. What will actually protect you is understanding why this pill attacks your kidneys in a way that gives you no warning, none, until the damage is already done. Let me tell you about Linda. Linda was 71 years old, a retired nurse from Georgia, 34 years caring for other people's health. She walked 3 miles every morning. She didn't drink. She didn't smoke. She monitored her blood pressure like clockwork. But Linda had arthritis in both knees, and for years, every single day, she took ibuprofen, just 2 tablets, the recommended dose, exactly as the label instructed. When she came to my office, her kidney function had dropped to 41%, stage 3 chronic kidney disease, no symptoms, no warning, just a routine blood panel that stopped both of us cold. She looked at me and said, "Doctor, how is this possible? I was a nurse. I should have known." And that's exactly the point. Linda wasn't careless. She was uninformed. There is a profound difference between being compliant and being truly informed. That difference is why I'm making this video today. To understand why this pill is so dangerous, you first need to understand what your kidneys actually do, and why, after 50, the rules of the game completely change. Your kidneys are the most underappreciated organs in your body. Right now, without any effort from you, they are filtering your entire blood supply, every single drop, approximately 40 times per day. They remove waste. They regulate blood pressure. They control fluid balance. They signal your bones to stay strong and your body to produce red blood cells. They are not simply a filtration system. They are the foundation everything else depends on. But here is what most people don't know. Your kidneys have no alarm system, no sharp pain, no early warning signal. Chronic kidney disease is, in the words I use with every patient who sits across from me, a silent thief. It moves in slowly over months, over years, and by the time you feel something, by the time the swelling in your ankles appears or the exhaustion becomes impossible to ignore, you may have already lost 50, 60, even 70% of your kidney function. Irreversibly. Now add age into this equation. After 60, your kidneys, like the engine of a high-mileage car, still run, but they no longer have the reserve capacity they once did. Their filtering rate naturally declines with every passing decade. The tiny vessels inside them become more fragile. Their ability to recover from chemical stress slows significantly. What your kidneys shrugged off at 35 leaves a scar at 65. And this is precisely where the danger begins, because millions of adults over 50 are managing daily pain, arthritis, back pain, joint inflammation, and they are reaching for the same over-the-counter solution their doctors have recommended for decades, believing that because it doesn't require a prescription, it must be safe for long-term use. That assumption is costing people their kidneys. The medication we are talking about today belongs to a class of drugs so familiar, so deeply embedded in our daily routines, that most people never once question it. It is not a rare pharmaceutical. It is not something obscure. It is almost certainly in your home right now. And research, published in peer-reviewed journals, now shows it can cause more cumulative kidney damage than moderate, regular alcohol consumption. That is not a headline designed to frighten you. That is the data, and you deserve to know it. If you go to the description of almost any health video on YouTube right now, you will find someone trying to sell you something, a supplement, a detox protocol, a sponsored product promising to flush your kidneys clean in 30 days. I am not going to do that. What I am going to give you today is the same conversation I have with patients inside my clinic, the one that doesn't fit inside a 15-minute appointment, the one that gets rushed past because there are 7 more people in the waiting room, the one that, frankly, the pharmaceutical industry would prefer stayed inside those 4 walls. I have no product to sell you. I have no financial relationship with any supplement company. What I have is 22 years of watching preventable kidney damage accumulate in good, responsible people who were simply never given complete information. Most videos on this topic will tell you the name of the pill and stop there. That is not enough, because knowing the name without understanding the mechanism means you will underestimate the risk, exactly the way Linda did for 11 years. Today we go deeper, and that deeper understanding is what will actually protect you. So here is exactly what we are going to cover today. I'm going to reveal the specific pain pill responsible and the precise biological mechanism that makes it so destructive to kidney tissue. Then I will show you the 3 groups of people who face the highest risk, often without knowing it. And finally, I will give you 3 practical, doctor-proved steps you can bring to your very next appointment or your very next trip to the pharmacy. We will move from the most important context down to the single most dangerous situation of all. Stay with me, let's begin. The first group I need to tell you about is the one that surprises people the most, because they don't consider themselves heavy users at all. I call them the accidental daily dependent. This is the person who started taking ibuprofen, the world's most consumed NSAID, a non-steroidal anti-inflammatory drug, for a specific temporary problem, a pulled muscle, a flare-up of knee pain, a stubborn tension headache. The intention was always short-term, a few days, maybe a week. But the pain didn't fully resolve, so the pill continued, and gradually, almost invisibly, occasional became routine, routine became daily, and daily became something they no longer even thought about, the same way they didn't think about brushing their teeth. Here is what is happening inside the kidneys during that entire time. Your kidneys depend on a precise, steady blood flow to function. To maintain that flow, your body produces natural compounds called prostaglandins. Think of them as the internal pressure regulators that keep the tiny arteries feeding your kidneys open and responsive. They are your kidney's life support system. Ibuprofen, and every NSAID in its class, works by blocking prostaglandins throughout the body to reduce pain and inflammation. That is exactly what makes it effective, but it does not discriminate. It blocks the prostaglandins protecting your kidneys just as aggressively as it blocks the ones causing your knee to ache. The result, the arteries feeding your kidneys constrict, blood flow drops, oxygen delivery falls. It is, in precise terms, like slowly tightening a clamp around the water supply to a garden. The garden doesn't die overnight, but week after week, the damage accumulates quietly without a single symptom until the filters inside your kidneys begin to scar. I had a patient named Ronald, 68 years old, former high school football coach from Tennessee. He took ibuprofen every morning for 3 years for chronic lower back pain, never exceeded the recommended dose, not once. When his GFR, his kidney filtration rate, came back at 44%, he was genuinely speechless. I read the label every time, he told me. It never said anything about this. And that is the tragedy. The label tells you about your stomach. It does not tell you nearly enough about your kidneys. If this sounds familiar, if you have been taking ibuprofen or any NSAID regularly for more than 2 weeks without medical supervision, Please keep watching, because what comes next is more serious still. Now we move to the second most dangerous situation, and this one is far more common than most people and most doctors realize. This is the person who takes an NSAID alongside other daily medications. Think about the average adult over 60. They may be managing blood pressure with a prescription, perhaps a diuretic, a water pill, to reduce fluid retention, maybe a medication for heart function, or an ACE inhibitor their cardiologist prescribed after a routine checkup. These are responsible people doing exactly what their doctors told them. But here is what frequently doesn't happen. Nobody sits them down and explains what occurs inside the kidneys when those medications meet ibuprofen. The interaction is called the triple whammy, and it is one of the most well-documented yet most under-discussed drug combinations in nephrology. Here is the mechanism. ACE inhibitors and ARBs, common blood pressure medications, work by dilating the blood vessels leaving the kidneys, reducing pressure. Diuretics reduce the overall fluid volume circulating in the body. NSAIDs simultaneously constrict the blood vessels entering the kidneys by blocking prostaglandins. When all three are present at the same time, kidney blood flow doesn't just reduce, it can collapse, acutely, rapidly, in ways that can trigger sudden kidney injury within days. I treated a patient named Evelyn, 74 years old, retired librarian from Michigan. She was stable on 2 blood pressure medications for years. Then winter arrived, her arthritis worsened, and she began taking ibuprofen daily for 6 weeks without mentioning it to her physician. By the time her son brought her in, her creatinine levels had nearly doubled. Acute kidney injury on top of already declining function. "I didn't think I needed to mention something from the drugstore," she said. That sentence haunts me because it reflects exactly how millions of people think about over-the-counter pain relief as something separate, something harmless, something beneath the threshold of medical concern. It is not, and the combination can be catastrophic. But even this is not the most dangerous situation of all. Before we get to the most dangerous situation of all, the one that carries the highest risk of permanent, irreversible damage, I want to pause for just a moment. If anything we have covered so far has resonated with you, if Linda's story, or Ronald's, or Evelyn's sounds a little too familiar, I want you to leave a comment right now. Tell me your age and how long you have been taking a pain pill regularly. Just write it below, 2 numbers, that's all. Because the pattern I see in those comments tells me exactly who needs what comes next most urgently. And now we arrive at the most dangerous situation of all. Not the occasional user, not the person mixing medications. This is the person who has been taking an NSAID every single day for years and feels completely fine. No swelling, no fatigue, no pain during urination, nothing. This is the patient who frightens me most, because the absence of symptoms is not evidence of safety. With kidneys, it is almost the opposite. It is evidence of how masterfully this organ conceals its own destruction. Here is what the research now shows with unmistakable clarity. A landmark study tracking over 10,000 adults found that regular long-term NSAID users, people taking ibuprofen or naproxen daily for more than 3 months, showed measurably accelerated decline in their glomerular filtration rate compared to non-users. The decline was gradual, consistent, and clinically silent the entire time. To put that in terms that matter, their kidneys were agging faster than the rest of their body. Faster, the data suggested, than the kidneys of people who consumed alcohol at moderate, regular levels. That is the headline your doctor doesn't have time to deliver. Now add the compounding factor. Every year of continued use, the scarring deepens. The filtering units inside the kidney, called nephrons, do not regenerate. Once they are gone permanently. You do not get them back with rest. You do not restore them with water. The damage is structural, and it accumulates in complete silence until the day a routine blood test reveals a number that changes everything. I think about Linda, 34 years as a nurse, a woman who dedicated her life to understanding the human body, And still, this slipped past her, not because she was careless, but because nobody connected the dots clearly enough, early enough. You are getting those dots connected right now. And the most important question isn't what has already happened. It is what you do from this moment forward. Let us take a moment to bring everything together. Today we have uncovered 3 critical situations that place your kidneys at serious, measurable risk from a pill most people consider completely harmless. We started with the accidental daily dependent, the person who began with a temporary problem and quietly crossed the line into routine use, never realizing that every dose was slowly constricting the blood supply to their kidneys. We moved to the dangerous drug combination, the patient taking NSAIDs alongside blood pressure or heart medications, unknowingly triggering what nephrologists call the triple whammy, a collapse in kidney blood flow that can cause acute, rapid damage. And finally, the most dangerous of all, the long-term silent user, feeling perfectly fine, while years of accumulated scarring quietly erode kidney function that can never be recovered. 3 situations, 1 common pill, and damage that outpaces alcohol. My goal today was never to frighten you. It was to hand you something your appointment couldn't, complete information. Because here is the truth that matters most. Kidney damage from NSAIDs is not inevitable. It is not your destiny. It is preventable, but only if you know what you are dealing with. You decide whether to speak to your doctor before your next dose. You decide whether to ask about safer alternatives. You decide whether to get your kidney function tested. You decide whether to pass this information to someone you love. Knowledge does not fix the past, but it absolutely determines what happens next. That power belongs entirely to you. If this video opened your eyes today, I want to ask you to do one thing right now. Share it. Think about the person whose face came to mind while you were watching this. The family member managing daily pain, the friend who keeps ibuprofen on their nightstand, the parent who has never once questioned what that pill is doing beyond relieving their discomfort. Send it to that person, today, not tomorrow. Life-saving information only saves lives when it actually reaches people. And if you want to keep receiving clear, honest, no-nonsense information about protecting your kidney health, subscribe and turn on notifications. I will see you in the next one. Thank you for being here today. Thank you for caring enough about your health and the health of the people you love to watch this all the way through. That tells me something important about you. Remember, Linda, remember that being compliant and being informed are not the same thing. You are informed now. I am Dr. Donald Brown, and I sincerely wish you a long, healthy, and vibrant life. Take care of your kidneys, take care of your life.